I am here at ASH 2019, and in this Congress it has become more and more evident the relevance of genetic characterization of AML and also the impact of studies on minimal residual disease with influence on outcome, mainly on relapse incidence, but also in survival. It is well known that certain genetic features of leukemic cells influence the response to initial therapy and also to relapse occurrence. And this is well known for the last 10 years. And more and more mutations are being identified. So these discoveries have led to the European Leukemia Net to establish a risk classification into 3 categories: favorable, intermediate, and adverse, that are very important because the prognosis is very different between the 3 categories. So the first category is so-called favorable, as mentioned, and for diagnosing that, we need to have the cytogenetic characterization and also the study on mutations in NPM1, FLT3, ITD, with a study also of the allelic ratio and CBP alpha. And for the adverse category, we need also cytogenetics to identify poor risk abnormalities, but also, and this is new from the last ELN classification 2017, that we have to also do a molecular study of ASXL1, RUNX1, and P53. So now, for a correct diagnosis of this disease, we need to have access to these molecular studies. On the other hand, MRD, both by PCR, when there is a marker, particularly in CBF AML, and also in NPM1 AML, it is very relevant because people who have a high number of specific transcript copies have a higher incidence on relapse, and these patients should be submitted to an allogeneic transplant. But for those cases of AML without a specific marker that may be followed by PCR, MRD by multiparameter flow cytometry is also very important. Now, some studies are showing that next generation sequencing of AML may also be helpful not only for identifying mutations at diagnosis, but also for follow-up of minimal residual disease through this methodology. A recent study from the Hobon group has shown that the combination of NGS and flow cytometry may be very important to detect patients who are going to relapse. So the 2 methods are complementary. So the summary is that every single patient with AML should be studied at diagnosis deeply with molecular technologies. Nowadays, NGS is being introduced more and more, and after chemotherapy, they should be followed by molecular methods or MRD methods to assess whether there are resistant cells, because these cases have a particularly poor outcome.